Hi, everybody. This is Rhonda Cobb, the Money Coach, and welcome to our show. In case you have not yet visited the new website, you need to do that, rcmoneycoach.com. And of course, as always, if you have a question or you need more information about anything we discussed today or in the past, send me an email, rcmoneycoach@gmail.com. And don't forget to get into the 10-day fast start money management program, because if you're like everybody else at this time, you need to get a little bit of a grip on the way things are going, and this will help you do it really quick. Now, today on our show, we have someone that is going to help you out so much with the information. So you might want to grab a piece of paper and a pencil so you can take notes. But we have a returning guest this week. His name is Dr. Bill Hennessy. He is a medical doctor and the CEO of Pratter. What Pratter does is help millions of people save billions on health bills. Welcome to our program again, Dr. Bill. How are you?
Well, good morning and happy Pratter Day, Rhonda. I'm ready to help people save money on healthcare costs. Let's get rid of surprise medical bills.
Oh, I couldn't agree more. And the funny thing is so many people don't even realize what a surprise medical bill is. You know, they get these bills and they don't realize that they have actually been a victim or taken advantage of. So why don't you start by telling people exactly what a surprise medical bill is?
It usually comes from a hospital. There are other types of providers, such as surgery centers, imaging centers, and doctors, but the hospitals are the best, meaning the worst, as they provide a pay this many $1,000s. Now, they don't tell you the price of care before. They don't tell you the price of care after you receive it. You have to wait a month until you get the bill. That's a surprise bill. Now, you do have rights as a healthcare consumer, and they should be exercised so you don't get a surprise bill.
Absolutely. And then there's the double whammy to the surprise bill. Oh, yeah, by the way, surprise. While you were asleep for your procedure, we called in Dr. So-and-so, who is not in your network. Surprise, your insurance isn't going to cover his portion of the bill.
That happens in Rhonda. That is the best deal in medicine. You know why? Because that care is free. There is no legal binding agreement between you and that assistant surgeon or the anesthesiologist, or if the hospital's in network but the ER doc's out of network, you have not signed a direct legal binding contract with that out-of-network provider. When they try to send you an intimidating bill, we encourage you to send a nastygram back. Don't be bullied, be the bull. You state, you, doctor, didn't.
Or option.
Uh-oh. Dr. Bill, you still there?
For the time of care.
There we go.
Yes, I am. I'm still here.
Okay.
Can you hear me?
It's kind of going in and out.
It did go in and out a couple times. I don't know if we need to start over, but you did go in and out about 3 times in the first 5 minutes.
Wow. Joe?
It's coronavirus time. Everybody's on.
All right, we can start all over if everybody would like to do that.
PI meetings and Zoom meetings.
Yeah, there's plenty of traffic on the internet. There's no doubt about that.
Something's going wacky because I keep hearing other stuff too, and I'm on Skype. I'm not even on the phone.
Okay, so what I'm going to do...
And I'm not hearing what you're hearing, but when you say you're hearing something, Rhonda, you just cut out for me. It's just quiet.
Okay, Rhonda... Bill, you there?
I am here.
Okay,
yeah,
okay.
You even just cut out right now.
Yeah, it's just what I was saying. Okay, so what I'm going to do is I'm going to call you both back, okay? Let's start a new line.
Okay.
Yeah, that'll probably work. Okay,
Right,
bye-bye.
Bye-bye.
Bill again.
Okay, Bill, we got you back on. Rhonda should be with us in a minute.
Hello?
Okay.
Okay.
Hello.
Okay, I hope this is better.
Yeah, and I'm here so
Yes, me too.
I can make notes and when we have issues, correct them.
Okay. All right.
So I'm counting you down again.
All right.
Here
Let's
we
just
go.
start from the beginning.
All right.
Yes.
Going in 3, 2, 1.
Hi, everybody. This is Rhonda Cobb, the Money Coach, and thank you for joining us for today's show. You're going to really get a lot out of today's show. So, before we get started, I do want to invite you to visit the website, rcmoneycoach.com. And if you have a question, of course, you can always email me at rcmoneycoach@gmail.com. Now, today's guest, Dr. Bill Hennessy, the CEO of Pratter, is going to share with us what he does best. He's going to help you save money on your medical bills. That's what Pratter does, helping millions save billions. So welcome to the show, Dr. Hennessy.
Well, thank you, Rhonda, and happy Pratter Day.
Thank you. It's awesome to be able to talk to you. I know we talk back and forth quite a bit on LinkedIn. We get into some really good discussions. And now, with everything going on in healthcare and the world, it is a great time for you to come back on the show so that people can have their memories refreshed of how they can manage their own healthcare bills and the things that can impact, because we know that we are going to be heading into some pretty tight budgeting times for individuals as we go forward out of this pandemic. So we were we had to start over, everybody. So we were talking about what a surprise medical bill is, because so many people are going to be more than a little surprised when they get some of these bills. So, Dr. Hennessy, why don't we go back and repeat what we were talking about? What is a surprise medical bill?
It's most commonly furnished by a hospital who just gives you the multi-$1,000 unitemized. Pay $5,000. And you have to ask for an itemized bill to the price of care before you receive it or after you receive it until you get the bill. That's referred to as a surprise medical bill. And the way to avoid it is you ask for the price ahead of time. As per the 2010, which I call the Unaffordable Care Act, there is part of the law called Public Health Service Act, Section 2718, that says the hospital has to tell you the charges for their care before the time of care. And it's even supposed to be posted. They don't do that, but that's a leverage point if you actually needed hospital care. Because once they send you the surprise bill, you're not going to have to pay it all if they didn't tell you the price of care ahead of time. That predatory billing is not permitted. They cannot hold you a financial hostage had they not told you the price of care. Basically, at that point, you're dealing with a federal outlaw.
Well, and it goes on so much. I know when I'm dealing with my clients and the people that I help when they enroll in Medicare, and they bring me things and they're like, you know about this, look at this, what is this mess? And they will literally be at wit's end. Some of them are so frustrated they have left behind their gracious personality, and they're angry and they're yelling or they're crying just in frustration as I work through it, and after the fact try to get this all cleared up. But I like what you're saying. People need to take a little bit more initiative at the front end and
Yes.
ask for an estimate, a very good written estimate, before they check in for whatever they're getting.
Yes. To get the most affordable care, you stay away from the hospital. Hospitals are infirmaries. They're used to take care of sick patients who stay in the hospital overnight. If that's all we use hospitals for, we save lots of money. The facility fees at surgery centers, imaging centers, blood work centers, and urgent care centers that are not owned by hospitals are much more affordable. And sometimes it's easy to see on a website where it is or is not related to a hospital. You can call at least 2, let's say, imaging centers that you think are not related to a hospital and ask them, are you related to a hospital, or does the hospital do your billing? The answer is no, you say. I need fill in the blank, chest x-ray, mammogram, or abdominal CT. What will your best price be? And if you call 2 of them to get more valuable information to see if they're priced similarly, and inevitably, the freestanding ones not owned by hospitals are going to cost less than the ones at hospitals.
And in many cases, it's going to be a lot less. But what happens to the person who is a little bit less assertive than you and me, and their doctor told them, go down the hall to this, or they told them where they're going to go. And of course, where they're going to go is affiliated with the huge hospital that owns that doctor's practice and also owns the testing facility.
Reality check-in. You must be more assertive. There's 2 sayings at Pratter. Number 1, don't go down the hallway. That's where you're going to go bankrupt or get a big surprise bill. Number 2, trust your doctor with your life, not your wallet. Those doctors employed by hospitals are tracked, literally tracked, by electronic medical record systems. Electronic medical record systems do not make any of us healthier. They have no proof of saving any lives over no electronic medical records. What they do is permit hospital administrators to snoop on doctors, and if they refer to care outside of the hospital network, they get pretty story. Hardly anybody wants to say it out loud. But I think putting others first and serving them, which is the focus of Pratter, is the right thing to do. So you just need to tell your doctor, I need to go to someplace more affordable. And the truth of the matter is your doctor will be okay with it. That if your doctor can write down or document patient needs to go elsewhere because of money or health plan, the doctor won't get fired. But right. The sad thing is the doctor doesn't care if you're willing to go bankrupt and doesn't care about your salary. They just want to save their own job because the administrators are overlooking the electronic medical record. So in the 90s, we had drugs that became generic. And a drug costs less than a brand name drug. The brand name got to stay in effect for 10 years, and after that, generics could be made on that drug. Well, years later, what's the new norm on medical care? Well, if you go any place but the hospital, it's like the generic drug. It costs less.
It's true. It's true. And what's amazing is you're right. During open enrollment with my Medicare people, I would oftentimes give them a paper copy of their health plan formulary. And I would